I want to welcome you to our third webinar for Walk Kansas 2025. We're glad to have Marty Reed back with us again this afternoon. And just a quick introduction for Marty, and then I'll turn it over to her because she has a lot of good information to share about taking care of our feet. And I don't know about you, but when my feet hurt, it's pretty hard to be as active as I want to be. So just a little bit about Marty. She started a cardiac rehab in 1991 here in Manhattan, and she retired in 2022. She has over 45 years as a nurse and is now in her retirement doing some consulting and working also with K-State Research and Extension on some projects, one of those being our hypertension awareness and prevention program. So we're all getting to know Marty better, and I've known her for quite a while since working here in Riley County and now at the state position. So really glad to have Marty here with us today. She's going to be talking about how to have happy feet and how to take care of your feet. And if you have some questions, if you would either put those in the chat or the Q&A, and we'll kind of plan to hold on to those questions till the end, but she'll be glad to answer any questions that you have. So I'm going to turn it over to Marty now. She's here with me in my office. We're going to switch chairs, and she's going to share some great information with you.
Hello, everyone out there in webinar land. I hope you're enjoying a good morning. It's a little bit drippy here in Manhattan. Today, we are going to talk about how to keep your feet happy. Doesn't seem to want to move.
It's kind of stuck.
Once we get the slides going, we'll talk.
It wants to stick a little sometimes. There we go.
So why do you think foot care is important? Many of you probably have thoughts about foot care, but 80% of Americans over 21 have reported some type of foot ailment at some point in their life. The most obvious reason to me that you take care of your feet is because you want to be able to keep walking. In a lifetime, we walk over 75,000 miles. Think about your feet, the trauma that they are enduring as we stay active. So today we're going to talk about one of the common causes of foot pain, and that is neuropathy. Some of you may have heard of this word before. We'll talk more about that. We're going to review the importance of foot care along with prevention of any problems. And then we'll review the foot care basics from the American Diabetes Association. And then we're going to talk about exercises. If your feet hurt walking, any movement becomes more difficult. And when your feet hurt, like Sherilyn already kind of mentioned, you hurt all over. It's hard to stay moving. Sherilyn, can I move that thing there? Move that. Does that bar come down? Excuse me. Is it going to stay there? So what causes your feet to hurt? Okay. One of the common causes is peripheral neuropathy. So what is peripheral neuropathy? The nerves located outside of the brain and the spinal cord are in the periphery. We call them peripheral nerves. And they become damaged, causing weakness, numbness, and pain, usually in your hands or feet. Some of you may have already noticed that maybe you have some neuropathy or have heard of the word and wondering, why does my foot hurt? So you want to question yourself, could it be neuropathy? What causes neuropathy? There are various causes, but diabetes is the most common. Chemotherapy and certain medications can cause nerve damage in your periphery and causing peripheral neuropathy. Vitamin deficiencies like vitamin D can trigger neuropathy. A big one is injuries to your back or your legs, back surgery. Any of those things can damage the nerves when you have that surgery and trigger neuropathy in your legs. Autoimmune diseases like rheumatoid arthritis and lupus can trigger neuropathy. Infections such as shingles, Lyme disease are another reason people develop neuropathy. And one that people don't often realize is excessive alcohol consumption can trigger neuropathy. Ask yourself, what are your long-term goals? I think you would say to stay active and independent for as long as possible. But you got to have feet, healthy feet, to be active and independent. If you have diabetes, you face the risk of developing peripheral neuropathy, which is the most prevalent complication of diabetes. Over time, high blood sugar levels can damage blood vessels, but few people realize it also damages the nerves, which leads to diabetic neuropathy. We talked about this 3 weeks ago when I gave the webinar. Although it can affect your arms and hands, the nerves in your lower legs and feet are most affected. You may notice decreased sensation in your feet, maybe some numbness, maybe tingling, pain. Some people lose the ability to feel heat or cold. Diabetic neuropathy has a significant impact on your muscles and overall balance. The risk of falls goes up. It's because you lose feeling in your legs and you have decreased sensation. I remember some of my patients in cardiac rehab who had neuropathy had trouble feeling the treadmill belt move under their feet, and they were hanging on for a dear life. So the fear of falling because of neuropathy restricts your activities, contributes to weakness, and it can lead to depression. So you can understand why it's so important to keep that blood sugar under control. Diabetic neuropathy eventually affects nearly 50% of adults with diabetes. So if you have diabetes, your chance of developing neuropathy goes way up. 19 to 34% of you people who have diabetes, who have diabetic neuropathy, will develop a foot ulcer. 50 to 60% of those ulcers will become infected, which can damage the foot even more. Decreased blood flow makes treatment difficult, and some individuals may face possible amputation. And you see ads on TV all the time about wound care, wound care. If you have diabetes, your blood flow is so important. And if you've had diabetes a long time, the blood flow to that ulcer is restricted. The costs of diabetic foot ulcer care are greater than $1 billion a year. 150,000 hospital admissions per year, and a third of those admissions are due to an infection. So why do we do foot care? To prevent ulcers, prevent infections, so you can save your feet. Can nerve damage be delayed? The prevention of neuropathy in diabetes is largely focused on blood sugar control. We talked about this 3 weeks ago. I encouraged you to master your blood sugar. Get on top of it. Find out what is your blood sugar doing on a regular basis. In your mind, to prevent neuropathy, because once you have neuropathy, it cannot be reversed. Review your glucose goals with your healthcare provider or diabetes educator. Find out where your glucose should be. Some experts say if your A1C is less than 7, the likelihood of developing an ulcer is decreased. Now, that's that expert's opinion. Somebody else might tell you something different. We have a lot of reasons for taking care of your feet, and you're learning them right now. If you have an injury or a blister, you may not even feel it until the infection sets in. That's the problem with neuropathy. You could injure your foot, but may not feel it. Decreased circulation makes it more difficult for your foot to fight infection and heal. Nerve damage can also cause your feet and toes to change shape, making regular shoes uncomfortable and possibly damaging your feet even more. So things like hammer toes and bunions, a lot of it is genetics, but sometimes it also can be triggered by neuropathy. So when you see a hammer toe there in this picture, that would rub against the top of your shoe, could create an ulcer. Neuropathy eventually affects nearly 50% of adults with diabetes. I'm going to say it again and again so you remember. Foot care is an essential part of diabetes management. Now, you all know you're counting your carbs or your vegetables, but are you paying close attention to your feet? Because you want to prevent an ulcer and infection. Foot care basics. Let's see. These come from the American Diabetes Association recommendations for people who have diabetes. Foot inspection. We're going to talk about all of these individually. Bathe your feet daily. Use lotion on dry feet. Keep those toenails trimmed. Proper fitting shoes are a must. You like going barefoot? The American Diabetes Association has its own recommendations. A yearly diabetic foot exam is also recommended. So inspect your feet every day. Get acquainted with your feet. Find out what's going on with your feet. Look at the bottoms of your feet. And if you can't look at the bottom or see the bottom, get out a mirror. Check between your toes because fungus can grow there. When's the last time you looked between your toes? This is a great time to give yourself a foot massage. You can find out if you have a tender area or if you have a rough area or a new blister starting to form. Like I said, get acquainted with your feet. Be aware of the warning signs. Cracks or extreme dryness. You may need to put some lotion on. Do you put lotion on your feet? How often do you do it? Look for any color changes. Note, what color are your feet? Are they pink? Are they white? Are they blue? Are they gray? Note any pain, numbness, or swelling in your foot or ankle. When you're giving yourself a massage, a foot massage, you can tell if you've got any pain or tenderness or soreness, or if parts of it is numb. Check for cuts, bruises, sores, corns, calluses, or blisters. A lot of things to be looking out for on your feet. Fungus, infections, or drainage. Ingrown toenails. It can be difficult to remember what you see. Consider keeping a record. Date your observations. And some people might take a picture of their foot. The American Diabetes Association says do this on a very regular daily basis, but I recognize writing things down every day might be challenging, but write down maybe the first of every month or once a week what's going on with your feet. Looks normal, no redness, no swelling. Be aware, these are red flags, of a blister, cut, or other injury that doesn't heal after a few days, or if you start to see drainage. If the skin of your foot is red, warm, or painful, or if you have a callus that is dark, there may be dried blood inside, which can indicate a wound under the callus. These are all signs of infection. You want to see your healthcare provider. Do not delay. Wash your feet daily with warm water and mild soap. It's okay to do a little foot soak, maybe for 5 or 10 minutes at the most. Some experts say foot soaks are not recommended because it might soften the skin too much. I like to do an Epsom salt foot bath from time to time when my feet are tired. But the most important thing is to dry your feet carefully, especially between your toes. Moisturize those dry feet, but not between your toes. What's common among people with diabetes? Sweaty feet. Your feet lose a half a pint of moisture per day. To avoid bacterial and fungus infections, you must keep your feet dry. Consider moisture wicking socks if you have very sweaty feet. Some experts recommend an antiperspirant foot lotion. If you're not sure about it, check with your healthcare provider. Toenails, it's important to keep them trimmed. A good time to trim the toenails is after your bath or after you've bathed. Trim the toenails straight across. Do not cut into the corners as there's an increased risk for ingrown toenails. Finish up by using an emery board to file down sharp edges. And, some senior centers have foot care clinics once a month, and you can go there and have your toenails trimmed. That might be something to consider if you cannot trim your own toenails or no one in your home can trim them. What about ingrown toenails? The number one cause of ingrown toenails? Shoes that don't fit. People with diabetes who develop ingrown toenails have an increased risk of an infection. So remember, keep the toenails trimmed as long nails press on neighboring toes and they can cause a sore. If you have a corn, callus, or wart caused by friction, do not try to remove them. See a podiatrist or attend a foot care clinic for guidance on how to manage your ingrown toenail. Proper fitting shoes are a must. Has anybody out there in webinar land ever bought a pair of shoes that didn't fit? I suspect that's a big yes. When buying shoes, make sure they fit. Look for a roomy toe box. Experts say have at least a ½ inch from the end of your toe to the end of your shoe. And some even say be able to put your finger at your heel when you have your shoes on so that you have plenty of room in your shoe. Your feet expand 10%, so shop late in the day. Look for a good arch support and have plenty of cushioning. Stand while you're being fitted. Try on both shoes. Shoes should fit without pinching your toes or rubbing against your feet. What if your shoes don't fit or they hurt and you can't find anything in your size? Well, some people consider extra depth or extra wide shoes. People with hammer toes sometimes will look at an extra depth shoe, so you have more room in the toe box. Or you can ask your healthcare provider about special therapeutic shoes. The American Diabetes Association says for people with diabetes, they should wear their shoes. Avoid going barefoot, even in your home, to reduce the risk of injury. Wear socks and shoes or slippers at home. They give your feet extra protection. Remember, the moisture wicking socks help keep your feet clean and dry. What else? Before putting your shoes on, check for any sharp objects like small rocks. Let's say you've been out on the trail and it's a sandy trail and you go home and maybe some rocks picked up and fell on your shoes. It happens to me once in a while. Well, before you put your shoes on the next day, make sure there's no rocks in it. Years ago, when I was at a seminar, I heard a story about a man who was camping. He had diabetes and they were in tents. And he took his wristwatch off and put it in his shoe. The next morning, he put on his shoes and he didn't even feel the wristwatch. So he really had significant neuropathy. Well, by the end of the day, he had a significant sore. He ended up losing his foot. So the moral of that story is make sure and look inside your shoes before you put them on. What else? Protect your feet from heat. So if you're going to be out at the pool, put some sunscreen on your feet. And when your feet are cold, they recommend no heating pads because you might burn your feet and then a sore and an infection because of poor circulation. Yearly foot exam is very important. First thing you do when you go see your doctor or healthcare provider is remove your shoes. That'll remind the doctor that he needs to look at your shoes, look at your feet, excuse me. What is the doctor going to do? He's going to check your pulses. You have 2 pulses in your feet. He wants to see if there's a change in your circulation. He or she, excuse me. He or she will also do some nerve checks. They will ask you if you have a change in sensation in your feet. And they often use the monofilament test, which is a small wire like in the picture here he'll poke different parts of your foot while you're not looking to see if you can feel the sensation of that monofilament. The doctor or nurse will look for signs of damage or injury to your feet, any blisters, calluses. They're also going to see if there's a change in the shape of your feet. Are you starting to develop a bunion or hammer toes? Because we know they'll rub against shoes and the risk of an ulcer is increased. So far, we've talked about glucose control. Make sure you stay on top of your glucose. And if you don't know where your glucose should be, talk with your healthcare provider. We've talked about foot care, which included inspect your feet, get acquainted with your feet, bathe your feet daily, keep the toenails trimmed, make sure your shoes fit, and avoid going barefoot. We talked about the importance of an annual foot exam. What else? Well, of course, we have to talk about exercise. If you're unsteady on your feet, or if you have some neuropathy and you're not sure, use a walking stick, a cane, or a walker. Don't stop walking. You wear glasses to help you read. Why not use a walking stick to help you walk? What kind of exercise is best? I love this quote from Thomas Jefferson: of all exercises, walking is best. Thank goodness for Walk Kansas, right? There are benefits of exercise for everyone, especially for people with diabetes. It slows the progression of nerve damage. So there you go. If you're worried about developing neuropathy, exercise will slow that damage down. It can actually alleviate pain and tingling. Increased blood flow is going to help that. Improve blood flow. Strengthen the muscles. Better balance and coordination to reduce the risk of a fall. And look at that, you have better glucose control. So if you're having trouble getting that blood sugar under control, maybe you need to walk a little more. And of course, improved flexibility and strength. A lot of these things you already know. It's just a review. But another exercise that I think is really important for people that are trying to take care of their feet are foot exercises. This picture here, if you're standing right now, rise up on your toes. This helps to strengthen your feet. Rise up, hold it for 10 seconds, and then lower. Do it 5 or 6 times a day. Help with balance. Stability and improved circulation is what foot exercises can do. Here's another one, towel scrunches. Place a small towel on the floor, use your toes, try to pick up that towel. Repeat it 5 or 10 times. Foot rolling, use a tennis ball. Or some people will take a water bottle and chill it, maybe even freeze it and roll that under their foot, applying gentle pressure. Move it in different directions, back and forth, side to side, circles. Spend 2 to 5 minutes on each foot. It's a great way to give yourself a foot massage, and it increases circulation. Here's some really fun exercises with your toes. Try this one, toe splay. Lift your toes, spread them apart. Hold for 10 seconds. Repeat 5 times. This one's a little different. Your big toe is relaxed, pressing down, and you're going to lift all 4 little toes. Hold for 10 seconds. Repeat 5 times. And now the reverse. The big toe lifts. All 4 toes are down. Hold for 10 seconds. Repeat 5 times. Stability exercises. We can all benefit from balance exercises. Stand near a support surface, lift 1 foot off the ground. If you need to hang on, do that. Hold for 15 seconds, repeat on the other side. And then the toe heel rock is similar to rising up on your toes, except you're going to rise up and then rock back. Rise up and rock back. Do them throughout the day. These exercises will be available to you in a handout. Sherilyn will get them out to you within the next week, if not before. I think all of you will agree that foot care is pretty important. You may be thinking this is a lot of work. Foot care is time consuming. Bathing, toenail trimming, making sure your feet are dry, wearing the right kind of shoes and socks. But remember your long-term goals to stay active and independent. And we got to have healthy feet to be able to be active and independent. Lifelong learning. One of the reasons I do these webinars, even though I'm retired, is that I have always believed in lifelong learning. It's just, I think it's so important, and this helps me maintain my goal. Did you realize you're writing the story of your life right now? Foot care as part of your diabetes management might be a new chapter for you. It may not be the chapter you wanted to write, but it may very well be the chapter in which you learn the most. So today we talked about neuropathy, the importance of foot care, prevention, foot care basics, and exercises. We covered a lot of material. You can go to the website listed on the screen, this cdc.gov/diabetes complications, and you can learn more about foot care. And that brings me to the end, and I can answer those questions if you happen to have any.
All right, do we have some questions for Marty? Any questions? Any comments, anything that's worked for you with foot care?
And that's okay.
I think she gave us a lot of good tips.
Yeah.
Yes, yes. Yes, so if you know somebody that has diabetes, you know how important foot care is. But it's important for all of us, not just people that have diabetes. So, all right, thank you so much, wait a minute, we've got some Q&A. Okay. How do we know when to replace shoes?
Well, how long have you had them? That would be the biggest question. And some people, some experts say change them every year. I don't know how, if you wear the same pair of shoes every day. I have to say, I'm not sure if I have the best answer for that. You might talk to a specialist at the shoe store. You might ask your doctor. And what does K-State Research and Extension say about changing shoes?
Well, there were some recommendations from like a shoe that's like a tennis shoe or exercise shoe, and it's actually more like in the 6 to 8 months range if you're using those every day and walking and being active in them. And I think certainly if they start to not, you don't feel the support or they're not comfortable anymore, definitely you need to replace them. But I think it something that we all can fall into pretty easily is to maybe not replace them as often as we should. But yeah, we'll have to check into that. I might be able to include that in a newsletter in the future.
How do I know which shoes are best for walking? It's the most important thing is to go by feel, comfort. You want a good toe box, you want good cushioning and good arch support. Many people recommend athletic shoes, but if you find a pair of shoes that meets all of that criteria, there's no reason why you can't use those for walking.
We had a webinar last year for Walk Kansas that was on shoe selection. So when I send out the link to this webinar, I will also include the link to the other webinar. And that focuses more on selecting shoes. And so some of those questions might be answered there and give you more detail. Anything else that we can help with today? I don't think we do have any more questions. Oops, saw a couple more come through. Best way to manage thick toenails.
Thick toenails is related to a fungus. And there's different treatments that you can buy over the counter for thick toenails that you might try. Some people like tea tree oil, but make sure your feet are clean. And it takes a long time to get rid of that fungus. Any advice for plantar fasciitis? That is an annoying problem, but I will tell you that the toe exercises that I gave you were some exercises that I did last year that helped my plantar fasciitis. All of the exercises that I mentioned today are what's recommended for plantar fasciitis. Have you seen a physical therapist? They can often give you some suggestions as well.
All right, it looks like we've answered most of our questions. So I want to thank you all. You'll receive the link again to the recording, and I'll send out those exercise handouts and a link to last year's shoe selection webinar. And hopefully that will get you some good resources and tips on your way to having feet that are ready for walking. So thank you, everybody.